So we're moving on to our second case study, which is about your obligations out of hours and what the code says about providing 24/7 emergency cover. And as you can see, Alex Davies has shared a scenario with us that's on this topic. Before I introduce Alex, I just want to let you know that the client that he is talking about in this scenario is a client with limited means who could not afford the out of hours fee or any emergency treatment. So just to make that clear at the outset, that's the situation that the client is in. So Alex graduated from the Royal Veterinary College in 2020 and now works in small animal primary care in South Wales. Alex is also the president of Vet Mentor, a not-for-profit organisation dedicated to applying veterinary students and accessibility to veterinary careers. Alex won the BVA Young Vet of the Year award in 2021 for the creation of a virtual veterinary network. A virtual veterinary work experience program to increase veterinary aspirations in school students. So Chloe, can we play Alex's video, please?
Hi, my name is Alex and I'm a small animal primary care vet working in South Wales in a large multi-vet practice. I graduated from the Royal Veterinary College in 2020. From my experience working in out of hours over the last 18 months now, I've found that cases that happen or come in to see you overnight can actually lead to more ethical, moral, or a more emotionally kind of demanding environment. So the practice was called at around 11 p.m. to say that an owner had accidentally reversed over their own dog's leg that had escaped from the house when they were leaving the home. The other important factor to consider with this case is the owner actually wasn't registered with us and was actually not registered with any other veterinary practice. So I did my triage and it gave me the confidence really to say that this animal was in pain and needed to be seen, and that would be done without charging the out of hours fee, because I knew my responsibility would be to offer emergency first aid and to give some pain relief. And I think that was the alarm bells that were really ringing in my head, and I had the confidence to commit to those two responsibilities from that call. It's obviously something quite rare that we offer a free treatment to an animal in the veterinary profession. Actually, I think this is the only time where I've had to offer this emergency pain relief and first aid without ever charging anything for it. So when I was discussing with the owner, I came up with what I thought were the options available to us, whether the owner could afford them or not. These are the options, the things that we could do for this case right now. Discussing these options with the owner at around 11, 12 at night after a very stressful situation, an emergency with this owner, was actually very upsetting. And I think it was probably too much to talk about with this owner at that point in time. What I quickly worked out is that I didn't think the owner was in the right mindset to be making any decisions. I encouraged them to come back or call the practice the next day to talk about the options again with one of my colleagues, and also ask any questions that they thought of overnight if they had any. So what actually happened is that the owner did call back the next day to speak with a member of our staff. They actually spoke with one of the senior vets of the practice, and the decision was made to euthanize the patient. Now, any case like this has an emotional effect on us as vets, and you'll see lots and lots of cases like this. And despite me having options to save this animal, I was unable to fulfill those and do those because of financial restraints. This can also make you feel a little bit unhelpful or disengaged and sometimes disappointed. You spend a lot of time in vet school learning about orthopedics, and it's something you're really passionate about, and you learn how to safely take x-rays and deliver anesthetics. To not be able to do that can be sometimes really disappointing, especially when it ends in euthanasia. The textbook solution doesn't exist for every patient, unfortunately. As vets, we're brilliant at revising. We all throw this term term gold standard around all of the time, but it's actually quite difficult to fulfill that gold standard criteria because of other factors that are involved in the decision making. And I think I've learned that it's okay not to be confident in a case that's complicated, especially when it's ethically or morally complicated, or there's other professional factors to take into consideration. And I wish in that particular case, I had just called my backup vet, who's one of the senior vets and owners of the practice, and said, I'm sorry for ringing you so late, but I really need to discuss a case, not for clinical reasons, really, just for professional reasons. And I think that would have just given me a bit more confidence just to make the right decision and feel a little bit less anxious or doubtful about everything that I talked about with that owner. I think hearing from senior vets who may have experienced this before can give you a really good insight on what you could do better next time. Mentorship is really important, and using your senior colleagues is a great way to develop your own ability through the power of mentoring.
So I just wanted to pick up on something that Alex said there about this gold standard, or the gold standard that gets bandied around. That's actually not something that the RCVS makes reference to. It's not a term we ever use, because as far as we are concerned, when you are treating an animal, you're treating them holistically, taking into account all of the circumstances of that animal, and that includes your client's financial situation. So as we talked about when we were talking about Izzy's case, care that is adequate and appropriate takes into account that wider scenario. So what is appropriate for one patient where they're fully insured or where money is no object is one thing, but what is appropriate for another patient where there are financial limitations, it's something else might be appropriate. So just to kind of really stress that point, that this gold standard is not something the RCVS requires. What we require is care that is appropriate and adequate and takes into account that all of the circumstances relating to the animal. So I thought it was quite interesting there that Alex said that when you're in that scenario, when you know there's things that you can do for an animal, but you can't because of those limitations, you can feel, and the words he used were disengaged, unhelpful, and disappointed. And I wondered whether that was something that perhaps those of you who are in practice have felt when you've been in these situations. It's certainly something that we hear, that kind of helpless feeling that you could have done more, but it's kind of frustrating. Emma, I don't know if we have, yeah, Ella, a lot. Absolutely. Ella in the chat says yes, she feels that often. Emma, I wonder, have we got any comments or questions
Yes.
in Slido about this one?
Yeah, we do. So one of them is, how do you get around this free out of hours? Where do you draw the line? And then also similar to the question above, what is the legislation guidance around giving emergency first aid cost-wise? When can we not charge for this?
Okay, well, as if by magic, my next slide deals with those questions, hopefully. So if I take you through what the code and the supporting guidance says about hours, hopefully it'll give you a flavour of what the position is. So veterinary surgeons in practice must take steps to provide 24-hour emergency first aid and pain relief to animals according to their skills and the specific situation. So as veterinary surgeons, you must provide pain relief and first aid to animals. You are not obliged to go beyond that, so it's limited to first aid and pain relief. The supporting guidance elaborates. So 3.7 on this slide, to attend to the initial essential welfare needs of the animal, the primary consideration of the veterinary surgeon is to relieve the animal's pain and suffering, and in some cases euthanasia may be appropriate, and that's something to bear in mind where means might be limited. And first aid and pain relief should be provided to an animal if, for whatever reason, the owner does not have a usual veterinary surgeon or practice, which is the situation that Alex found himself in. They didn't have access to another practice, and so he rightly provided that care. In terms of costs, so what we say is costs for and arrangements for payment should be discussed at an early stage, but, and this is the key, immediate first aid and pain relief should not be delayed while financial arrangements are agreed. And so you are obliged to provide that first aid and pain relief before you get into what's going to happen about payment and all that kind of stuff. And if the situation turns out that the client can't pay, well, that it's unfortunate, but you are still obliged to provide that first aid and pain relief, but it is limited to first aid and pain relief and not beyond. And we go on to say, and sorry, just to go back to the previous point, first aid and pain relief might include euthanasia. So going on later in the supporting guidance, we say following initial assessment and provision of emergency first aid and pain relief, the veterinary surgeon should make a full and realistic assessment of the prognosis and the options for treatment or euthanasia, take into account the particular circumstances of the animal and owner, and veterinary surgeons are not obliged to carry out ongoing treatments for which the owner is unable to pay. So once you have discharged your obligation to provide first aid and pain relief, you don't need to go further than that, and if the client can't pay, then they will need to go elsewhere, shop around and see if they can find it cheaper elsewhere, or make the difficult decision to have their animal put to sleep. So that's where you stand on your out of hours obligations, and I hope that answers your question. So one of the things that Alex mentioned in his scenario was talking to senior vets for guidance, and actually it's something that our next vet mentions as well. So I wanted to ask you all, who do you speak to ask for guidance when you encounter a difficult situation? So could you just pop it into Slido? Who would you choose to speak to? So in the chat, we've got second on call, my mentor, clinical directors. Yeah, just see those numbers creeping up on Slido. Give it a couple more seconds. Got the VDS, yeah. Senior vet, your manager. Okay, so let's have a look at what your thoughts are. Okay, so experienced vet in your practice, your colleague, so your GDP advisor, yeah, clinical director, any colleague, someone outside the profession. If it's something ethical that can be useful, you can also, of course, speak to the RCVS advice team, and we will give you the details at the end about how you do that. And please do use the service. I think the RCVS is unique in the sense it's a regulator that provides a kind of support and advisory service to the profession it regulates. So please do use that service.